With a relentless focus on excellence in healthcare, Pullman Regional Hospital presents the Health Podcast.
Between me and what I've heard from my girlfriends, I think we've tried all of the birth control options out there. With so many different kinds, it can be difficult to find the right one that works for your lifestyle and your body. Joining us to talk about birth control options is Teresa Tomaszewski, a physician assistant at Pullman Family Medicine. So, Teresa, tell us why birth control is, of course, so important.
Well, Caitlin, birth control is important because it helps to prevent unintended pregnancies, and in some cases, such as the barrier method or condom, can reduce the transmission of sexually transmitted infections.
Now, when we're talking about birth control, what are the main types? It feels like there's so many out there now.
The main types of birth control include the barrier method, such as a male or female condom, short-acting hormonal methods, such as the intramuscular injection, the progestin-only oral contraceptive pill, a combination oral contraceptive pill, which includes a combination of estrogen and progestin, a patch, and a vaginal ring. Longer-acting methods of birth control go from 3 to 10 years in duration. We have an implantable rod and an intrauterine devices. So there are a couple different kinds of intrauterine devices. One is called the copper IUD, and that has no hormones and can last for up to 10 years. And the Kyleena or Skyla and Mirena are low-dose progestin, and they last from 3 to 6 years. There are also permanent methods for birth control or contraception, including a vasectomy for men, or a tubal ligation, or a hysterectomy for women.
Now, looking at all of these types, what are some of the pros and cons of each of these options?
So with a barrier method or the condom, a pro is that you don't have to take a daily pill, you don't have to have an office procedure to insert it, and it can prevent the transmission of sexually transmitted infections. Cons would be that you have to be able to apply the condom before sexual intercourse for it to be effective. And then the short-acting hormonal methods, pros are that they are short-acting. So if your plans change and you want to try to conceive, you can stop the short-acting hormonal method and return to fertility relatively quickly. Cons are that depending on how often you want to take a pill or a patch or the ring, the frequency might be cumbersome for some people. The longer-acting methods, a pro is that it is long-acting, so you don't have to take a pill every day. You don't have to think about, replacing the patch or going in for an intramuscular injection. A con is that it does require a short office procedure to insert the device, and being that it is long-acting, if your plans for fertility or trying to conceive change, you would have to have the device removed. A pro with the permanent method, such as a vasectomy or tubal ligation, is that it's permanent. You don't have to think about it. That is your permanent birth control. A con is that it does require a procedure and that this procedure is irreversible.
Now, with all of these choices we can make, how can someone determine what birth control is the best option for them?
Well, there are lots of questions that we can ask coming in for an office visit and talking with your healthcare provider to go through all the questions that are important to them and to consider what method have you been thinking about, how often would you be wanting to take the birth control or the contraception, how effective does the method need to be at preventing pregnancy, does it have additional benefits such as on menstrual bleeding or cramping, are there non-contraceptive benefits that the person is looking for? Does the person need a private method? Are they trying to conceal that they're on birth control or contraception? And what effect does this method have on their future fertility?
Great, Teresa. Is there any other important information people should know about birth control?
Absolutely, Caitlin. It's important for the person to know that the method that they're on today or tomorrow does not have to be the same method that they're on the rest of their lives. The methods can change just along with their lifestyles to align with their goals and plans. And as I kind of touched on earlier, there are non-contraceptive benefits. So depending on the method, you could potentially have a lighter period or no period at all. You could have reduced menstrual cramping. You could have decreased acne and even reduction in the risk of some reproductive cancers. And so when trying to determine which oral contraceptive or contraceptive for birth control method is best for you, having that discussion with your healthcare provider, as well as talking about screening for sexually transmitted infections and your overall health and wellness. And this can be done every year during your annual wellness for both men and women.
Well, we so appreciate your time and your work in this field, Teresa. Thank you for joining us today, and thanks for breaking down those options for us. That was Teresa Tomaszewski, a physician assistant at Pullman Family Medicine. Find out more about Pullman Regional, as well as more episodes like this at pullmanregional.org. This has been the Health Podcast from Pullman Regional. I'm your host, Caitlin White. Thank you for listening.